Hello to our physicians. I'm Jane Salerno. The purpose of this presentation is to provide a step-by-step explanation of our calculations and reporting of an important healthcare metric, emergency department wait times. We address the implications of longer wait times and how the public would use the published data to make a decision. Let's look at our learning objectives. We will be able to differentiate between measures of central tendency and determine which to choose based on the sample data. Let's have a quick intro. ED wait time is defined as the time from emergency department arrival to departure for discharged patients. As per 2017 data from the CDC, ED visit rates have been steadily increasing. Many patients are experiencing longer wait times, as illustrated in this graph. Here is an overview of the measures of central tendency, which represent a central or a typical value for a probability distribution. These include mean, median, and mode. This is an explanation of how our department calculates and reports wait time metrics. Here we have our sample data on the left. To begin, we first sorted these values and then applied the formulas for mean, median, and mode. For a better representation of our selection of best measured tendency, we use this scatter plot diagram and observe that it clearly shows the cluster of values that are outliers. The mode at 180 minutes is the value that occurs most frequently in the data. The median layer values are closely connected and mark the central tendency of the data set. For mean at 126.23 minutes, we can see the values are scattered and loosely connected. The median is least affected by outliers and skewed data and retains its position, whereas the mean loses its ability to provide the best central location, as is evident from the diagram. Therefore, we'll take the median value of 130 minutes as the most accurate representation of our data set. Why is timely and effective care in the ED important? Delays can reduce the quality of care and increase risk and discomfort for patients. Long wait times are associated with increased morbidity and mortality and increase the risk of death and hospital readmission. Medicare's Hospital Compare is a reputable government site that the public can use for comparing ED wait times in their area. Easy-to-use steps include simply entering your zip code or the hospital name, which lists all hospitals by distance. Choose up to 3 hospitals to get information in 3 columns of data, and select the Timely and Effective Care tab in the banner to see ED wait times for your choices. Next, let's understand a few factors that assist the public in decision-making. There is other data from the Hospital Compare website listed here, and then the results you are looking for. Median ED wait time in minutes. It is important to remember, advertising wait times may encourage patients to self-triage in a dangerous way. For urgent conditions, always go to the closest ED. Published times may be inaccurate based on the dynamic nature of the emergency department. Let's look at what longer wait times mean to the stakeholders. At different hospitals, they can vary widely depending on the number of patients seen, staffing levels, efficiency, admitting procedures, or the availability of inpatient beds. For physicians and non-physician providers, Long stays in the ED may be a sign that it is understaffed or overcrowded, which means stressful and extended work shifts. For patients, it indicates delay in treatment, increased suffering while they wait, and often unpleasant treatment environments. For the hospital organization, inefficiency can result in patient loss and negative patient ratings, which adversely affect hospital quality and ranking. Shareholders in for-profit hospitals may become concerned and demand improvement. So, to conclude, excessively long wait times in the emergency department lead to higher health risks, patients leaving without being treated, overcrowding, low patient satisfaction, and increased costs. Triage processes need to be reassessed so patients can see providers sooner. Providers then have the time to diagnose and complete their documentation. From a policy perspective, minimizing wait times could potentially improve patients' health and lower healthcare expenditures. Patients should first consider a primary care provider or immediate care clinic visit prior to making an ED visit. Here are citations and references. To summarize, we learned about the 3 measures of central tendency, their use in data analysis, and the implications of long wait times to stakeholders. This presentation is a team effort of myself, Andrea, Ayushi, and Pooja. Thank you very much.